The prioritization of UK medical graduates is no longer just a discussion or an argument or something that is up for suggestions. It is now a decision by the government, and in the recently published 10 years plan for England that was published a few days ago, it was actually stated in that document that the government is going to see to the prioritization of UK medical graduates over IMG doctors. We've actually been waiting for this document because it was said that sometimes in summer this document was going to be released, and I was actually hoping that this document was going to contain a lot of details about this plan, about when is it going to be implemented, and even much more details. However, to my surprise, it was just a sentence in the old document that mentioned the prioritization of UK medical graduates. So I assume that there will still be further publications, further documents to give more details to the plan of the government in achieving this. Now, the question really is, what does this mean for an IMG doctor, whether here in the UK or outside of the UK? And that is what I'm basically going to be discussing in this video today. And I think this is very important so that IMG doctors can understand both the short-term and the long-term impact that this decision is going to have on them, on their career, and also for IMG doctors to begin to consider what is the next step following this plan, because a lot has been happening in the UK space in recent times about immigration, they publishing the white policy paper, which is more like the government's plan to really cut down on legal migration. And so a lot is really happening in that space, and so now this happening and this directly affecting doctors, I actually think that this is the point where IMG doctors need to start talking about what is the way forward, what is the next thing. And just like I said before, that the document doesn't contain a lot of details, and so I'm still not going to be able to say some things categorically that this is definitely this. But one thing that is very sure is that the UK government has decided to prioritize UK medical graduates over IMG doctors for specialty training. And when I say specialty training, I mean both foundation training, core training, and even the higher specialty training. I also think that it's very important to talk about the BMA standpoint in terms of about this ongoing discussion. And that is very important because I think right now we are at a phase where it seems like the government is willing to work with the BMA, and so it might actually be reasonable to think that the government might adopt the BMA's policy. However, in the document, it just says prioritization of UK medical graduates over IMG doctors. Nothing was said about the grandfathering policy that BMA as suggested. And so just to have a better and a clearer picture of what is going on, I'm going to talk about the BMA's part, especially based on the decision that was made at the recently concluded BMA annual representative meeting. Then we put all of this together, and hopefully we'll be able to get to a point where we can start talking about what is the way forward. What do we do from here on? So hello, my name is Blessing and I'm a doctor currently practicing here in the UK, and here on this channel I talk about medicine, I share about my journey as an IMG doctor, and also I talk about matters relating to IMG doctors. So feel free to actually become a part of the community, and I'm sure you already know that we are happy to have you here. So let's just get into this discussion today. Or let me just start by giving a bit of a background. So I think this whole thing started from last year December at the UK Resident Doctors Committee's meeting, where it was suggested, that the BMA should lobby for the prioritization of UK medical graduates. And this is based on the fact that over the last 2 years, the number of doctors applying for specialty training has significantly increased compared to what it used to be in previous years. It's actually significant because the increased number of doctors applying for specialty training has led to increase in the competition ratios for these various specialties. And this in turn has made it a bit more difficult for doctors including UK medical graduates, to be able to get into specialty training. And this is really the main reason why it became a concern. The other side to it is the fact that this increased competition ratio is as a result of increased number of IMG doctors applying for specialty training. In the last round, it was said that in the last round there was about 33,000 applications for specialty training. 12,000 out of this 33 was from UK medical graduates, and the remaining 21,000 was from IMG doctors, and with most of these IMG doctors being from outside of the UK. And so the BMA just considered that if this continues unchecked, it's going to get to a point where it becomes very difficult for UK medical graduates to be able to get into specialty training, especially because in the last 2-3 years, the government has actually increased the number of undergraduate medical posts. So it means that more doctors are graduating from medical schools in the UK. However, no significant increase has happened in terms of the specialty training position. So it means that a lot of doctors are graduating, but there is no space to actually accommodate this increasing number of doctors for specialty training. So in a way, all of these factors has put a strain on the entire process. And now with the increasing number of IMG doctors also joining this pool of doctors applying for specialty training, it seems to have worsened the situation. And so the BMA thinks that they should intervene in order to find a lasting solution to this problem. And so at the UKRDC, it was suggested that the BMA should move or lobby for UK medical graduates and IMG doctors who have up to 2 years of NHS experience and have been working in the NHS on or before the 5th of March 2025 to be considered at the same level as UK medical graduates. Sometimes last month, the BMA annual representative meeting, which is like a major decision making forum for the BMA, took place sometimes last month, and following the voting process, which is usually the way decisions are made, it was concluded that there was more votes for the prioritization of UK medical graduates over IMG doctors for specialty training. It's now a decision that the BMA is going to present to the government and willing to fight for. So let me just give you a breakdown of the decision from the BMA ARM. The first one is that doctors already working in the NHS, both UK medical graduates and IMG doctors with up to 2 years of NHS of working in the UK, will be prioritized for specialty training over doctors outside of the UK. 2. The policy is to be applied prospectively and not retrospectively. This means that it will protect IMG doctors who are already working in the UK on or before the 5th of March 2025. And this is basically the grandfathering part of the policy. Now, the third part is IMG doctors who have been in the UK before the 5th of March will be treated equally to UK medical graduates after they achieve 2 years of NHS experience. So, and the fourth part is that IMG doctors will start working from the 6th of March onwards will be deprioritized for specialty training compared to UK medical graduates and IMG doctors who meet the grandfathering policy. With all of this in the picture, it means that it's going to become much more difficult for IMG doctors to be able to come in for specialty training from outside of the UK. It will become almost impossible, number one. And number two is, even for IMG doctors who are already in the UK, it means that if you came in after the 6th of March, it means that you might not have the opportunity to get into specialty training because nothing is really guaranteed. And so it means that from when this policy, if eventually the government decides to adapt the BMA's policy, this is basically what's going to happen. But this is just BMA's position about this. And based on the recent document that was published, of course, we already know now that the government has made a decision about this discussion, which is that UK medical graduates will be prioritized. But just like I said before, nothing was said about IMG doctors, whether those in the UK or those outside of the UK. Nothing, there was no referral to the BMA's grandfathering policy. There's still a lot of ambiguity about this document. So it means that at this current point, we are not sure exactly what is the plan of the government. We are not sure of what extent the government is going to go in terms of this. Some persons asked about what becomes of IMG doctors who meet the grandfathering policy of BMA if the government decides not to take the grandfathering policy into, into their plan. So the BMA has reassured the IMG doctors that the BMA is going to fight for the doctors who meet the grandfathering policy, that it is only fair that these doctors who have contributed to the NHS be given the opportunity to be able to get into specialty training here in the UK. So, but if the government decides to, ignore this aspect of, the BMS policy, what then becomes of this IMG? What then becomes of IMG doctors in the NHS? That's number one. And then number two is for IMG doctors who are outside of the UK with this current policy, and now that is looking more like it's going to be almost impossible for these IMG doctors to be able to get into the UK for specialty training, then what is the way forward? Now, I think this is what I'll say here, that yes, the document has been published, but just like I said before, that a lot of details are still not clear. We are not sure of when this policy is going to be implemented. We are not sure of when it is going to, we are not sure of what extent the government is going to go in terms of prioritization of UK medical graduates. We don't have the answers to a lot of questions. But one thing is, it has not been implemented yet. So we are still probably waiting for further documents. So I will say that go ahead, for those who are preparing for the next MSRA, I will still suggest that go ahead with your preparation and, let's just see how things unfold. Number two is for those who have not started the plab pathway, maybe you're just considering it or you're still in the very early phase of, the journey. I think it might be a good decision for you to take a break, pause, get as much information as possible, process this information, and make a well-informed decision. Don't just jump into the process because, everyone is doing it. Please, don't actually get into that process if you are not sure of your opportunity to be able to to be able to relocate into the UK in the future. As it is right now, there are so many IMG doctors who are GMC qualified and are struggling to get jobs in the UK. And I wouldn't think it would be a wise decision for you to also join that pool without being entirely sure that it is the right decision. Now, for doctors who have taken the plab pathway and you are GMC licensed, but you're already GMC licensed, then I think that please still continue to apply for non-training roles. You might just get lucky and get a slot and be able to come in for non-training roles. Of course, coming in means that you're not going to be prioritized for specialty training. However, having NHS experience and combining that with your plab result might be enough for you to be able to get into some other healthcare system. If you have taken the plab 1 exam and you're not sure if you want to proceed to the UK for the rest of the plab journey, for some countries you might be able to skip some of their process with your plab 1 exam. I think somewhere like the Republic of Ireland, if you have passed your plab 1, you don't need to sit for your press 2. You're just going to automatically apply for press 3 and then you take it from there. So, and also in the worst case scenario, I think considering other pathways might actually be anyone's best bet at this point in time. There are some other countries that are open to IMGs, that are willing to accept IMGs. And so I would think that this might be the point to start doing your research, get as much information, decide which country you might really want to go to, if not the UK, and then start the process. So I know that a lot goes into the plab pathway, and I know that it's a lot, and I know that a lot of people might be thinking about everything that has gone into it. But then I would just say this is the current situation of things. There is no assurance that things are going to become different. If you look at the NHS long-term plan, you look at this new 10-year plan, everything is still pointing to the UK's intentional plan to train professionals domestically and cut down significantly on on IMG professionals. The plan actually from the long-term workforce plan is to reduce it from the current 25% to about 9 to 10.5%, and that is quite a significant cut. So I'm just trying to say that it may not get better. The reason I'm making this video is, number one, to keep you updated about the current happenings in terms of NHS jobs, especially in relation to IMG doctors, and also to put out information for you to be able to do your research and make an informed decision, because this is career we are talking about, and it wouldn't make sense to get stuck at a point just because of changes in certain policies. So I think that one of the things you should consider is countries that have more stable policies. So feel free to actually share your thoughts. I know it's been a really difficult time for a lot of IMG doctors. Some of you guys have actually come in comment section to, you know, share your thoughts about this. But then feel free to actually share your thoughts. What do you think about this? Do you have any questions, any concerns? I know some persons might still be thinking, oh, there's hope, or some persons trying to be positive. That is also good. But I think we are past that point of just being positive to being realistic. What are the chances? And even if you eventually get into the UK to work in a non-training role, the chance of getting into a specialty training position is also is very low. Nothing is really guaranteed. And are you willing to actually put your career on hold, you know, just because you want to come into the UK specifically? How about considering other countries that have much more to offer you as a doctor, and also in terms of your career progression? So feel free to actually share your thoughts, and this is how I'm going to be ending this video today. All right, take care. Bye.